The last week in April of every year is dedicated to the issue of immunization. Therefore, as the world marks Immunization Week, there is a call for everyone, as well as the government, to do a lot more to ensure healthy, long lives for all Nigerian children. Vaccines have proven to be arguably the most cost-effective health intervention in human history, saving millions of lives of children, especially in underserved areas of the world. It is 226 years since the deployment of the first vaccine against smallpox, a disease that has been successfully eradicated globally, and a vaccine development and use have come a very long way. Since the eradication of smallpox back in 1980, millions of lives have been saved, making many children live beyond their 5th birthdays. Thankfully, Nigeria also joined the League of Nations that have successfully eradicated poliomyelitis, the devastating illness that causes lifelong paralysis. However, Nigerian children are still grappling with vaccine-preventable diseases. Dr. Eduardo Celades, the Chief of Health for UNICEF, is with us now in the studio to discuss World Immunization Day and how Nigeria can drive its immunization campaign. Very good to have you here with us on Arise News. Welcome to Newsday.
Thank you. Thank you very much, Hawa, for inviting me here today.
Yes. So let's speak a little more about World Immunization Day. Could you tell us a little bit more? I mean, we went a little bit into the details in the intro, but tell us some more.
Right. So today, this year, it's 50 years that the immunization program was launched globally, the expanded program of immunization, 50 years ago. So much has been achieved, right? The smallpox, you said, that has been eradicated. Polio is only now in 2 countries, Afghanistan and Pakistan. More than 154 lives have been saved. However, after 50 years, we feel that the love is not there anymore, people with vaccines, right? Mm-hmm. Now we see vaccine hesitance. We see misinformation, mistrust, right? So we want, like, the people, the communities, the government, everybody to fall in love again with vaccination, with immunization. So this is why this week is so important. We are saying that humanly possible immunization for all. So that's the topic for this year. And basically is to try to ensure that all the children, especially the ones that don't have any vaccination, they have access to immunization services.
Well, yes, you talked about misinformation, and I know that some people say vaccines are linked to long-term health problems like multiple sclerosis, diabetes, autism. I'd just like you to speak around this. How true is this?
Okay, I will speak very clearly. It's not true, right? Most of the vaccines, they can have side effects. You get, for example, yellow fever, you will have maybe a little bit of fever for one day. Maybe you will have pain in your arm, right, for a few hours that you can get paracetamol. But they don't have long-term effects. Vaccines are monitored very, very carefully during years, right, to ensure that they are safe. But however, what we are seeing is a lot of rumors. For example, last year in Nigeria was introduced a HPV vaccine for young girls. A lot of rumors were around. As well, rumors with the polio vaccine. A lot of misinformation is around. The issue is, like, 50 years ago, there were only 6 vaccines when we started 50 years ago. All our parents, they vaccinated us, right? It was normal. Now there are more than 13 antigens, 13 vaccines. In some countries, like in Nigeria, are even more. And people after COVID, they start to question that, right? So we need to respond to this narrative. And your role as journalists is very important. Our role as UNICEF, the role of the communities, of everybody, to really try to pass the right message. If you love, if you care, if you respect, you need to vaccinate your children.
And how do you deal with that misinformation, especially in rural areas where it seems that it's important to target, and there are very heavy religious undertones sometimes to these, and societal, traditional undertones, which might be a little bit different than in the West? How is that dealt with in terms of getting the immunizations?
Right. That I would say that it's not only in rural areas. I mean, people think like rural areas of Zamfara. That is true, right? Or Sokoto. But as well happens in urban areas. Can happen in Makoko here in Lagos. True. Can happen as well we heard that in Kebbi, in the urban areas as well, there is a lot of mistrust about vaccination. So it can happen everywhere. We are doing 2 main things. One is to work with community leaders, with traditional leaders, but as well with religious leaders. Pastors, priests, imams, the sultan, the emirs, right, to try to rally their communities around that. The other thing that we are doing is to work with the communities, jointly with other partners like government, civil society organizations, WHO, UNICEF, and others, to really, for example, something that we are doing now is like the vaccination teams that they go to the communities. They are part of the community. It's people from the community, especially for the drops, when it's like the polio vaccine. So they can trust in their own neighbors, right? Because if sometimes comes someone from outside, comes a white man, or comes like someone that is not familiar with them, they will say why they are coming here, right? So we need to build that trust. If we don't build that trust, we're not going to succeed eradicating some of the diseases that we have. And the future can be promising. Nigeria is going to introduce malaria vaccine later this year. We have now a vaccine for cancer, the HPV vaccine. Who knows if one day we can have an HIV vaccine, right? We don't have it yet, but maybe. So, but if we don't fall in love with vaccines again, that's not going to happen.
Now, talking about building trust, I do know that some people, even in the West, they've been arguing in favor of natural immunity instead of vaccine-acquired immunity, especially for mild diseases like chickenpox, measles. I'm just wondering what your thoughts are on that.
You're right. We're seeing that trend everywhere, right? In the US, in my own country, in Spain, in the UK, everywhere this is happening. However, here for Nigeria, we forget something as well, and it's malnutrition, and it's the condition of the children, and the lack of access, right? Measles. Measles is a disease that in the Western countries, they don't kill any child, right? Or almost, because they are good, with good nutrition, etc. But here can be mortal, can be fatal, right? Because of malnutrition, lack of water, lack of good sanitation, the underlying conditions. So I think that the safest way to prevent like mortality in under 5 years old is vaccines. We have now one vaccine for pneumonia. This is the pneumococcal vaccine. One for diarrhea, rotavirus. I'm sure that you're familiar with that. The biggest killer that we have for under 5, malaria, we're going to have one as well, hopefully by this year and next year in the whole country. So we have the tools, and the tools work. So why to go for something that we don't know if really works and can have like fatal consequences for your children?
And maybe just a little bit of good news. What work has UNICEF been doing towards making sure that immunizations are trustworthy and they penetrate the areas that they need to go to all over the world?
So let me just give you 3 good news from the last few months.
Okay.
One is like the Nigeria faces outbreaks sometimes, right?
Yes.
Like the meningitis outbreak, diphtheria outbreaks. Why we are not hearing about that in the news now? Because of the vaccines have been made available, right? And the Federal Ministry of Health is leading on that. UNICEF has been supporting with the vaccines, etc. So we have been supporting immunization campaigns in Jigawa, in Kano, in Bauchi to really stop these outbreaks. That's why they are not in the news. You know, they say prevention is better than cure.
Cure, yes.
So that's a good news. The other good news was like the HPV introduction in Nigeria. Amazing. Almost 4 million girls were vaccinated against HPV. They will not have cancer when they're adults. That's huge. That's massive. That's a game changer. And the third one, the Federal Ministry of Health has launched this swap approach to bring all partners together to really strengthen primary health care and the health systems. And we are behind that. The goal is to have 17,000 health facilities fully functional, right? And to train more than 120,000 health workers. And we are working on that. So I'm optimistic, I have to say. We have challenges. It's not easy, but I think Nigeria can make it.
Well said.
Well, that's actually some good news. Now, just before we let you go, can you tell us the theme, of this year's celebration and what are some of the programs lined up? I know it's a week-long event. So what are some of the programs lined up? Briefly, please.
Yes. So the theme is humanly possible, immunization for all, right? And so we are supporting some outreaches, mobile brigades. We have now a team in Bauchi. As well, this week is going to be Malaria Day. So a lot of things happening. Please be tuned because you will be hearing a lot of activities. And if you are listening from our home, for the people like watching us today, please just take advantage and vaccinate your children. It's a good moment to do it.
It is. Never a better time than on World Immunization Day, right? Thank you so much, Dr. Eduardo Celades, the Chief of Health for UNICEF. Thanks so much for this important conversation and for coming in today.
Thank you.